Q とかも言ったのかな。Q はなんだ。anxiety。なんか今日も疲れたな。chemotherapy。Alright. Wonders of Medicine, Unit 10, Age, Getting a Hands-on Treatment. Deficiency means that a lack of something. Deficiency. Immunity means that the condition of being able to resist a particular disease. Diagnose means that to identify the nature of an illness by examination of the symptoms. Infection means that invasion of the body by bacteria or viruses. Suppress means that to inhibit the growth or development of something. Inhibit the growth or development of something. Suppress. Not too long ago, most people thought that contracting HIV was a sudden and sweet death sentence. After several decades of experience with this deadly disease, however, medical scientists have found drugs and treatment strategies that now allow HIV patients to live years or even decades with the disease. It is essential for those who have contracted HIV to be diagnosed early so that monitoring and treatment can be as soon as possible. The scientific community has accepted that the cause of AIDS is HIV. Once an individual has been infected with HIV, the virus quickly attacks the infection-fighting soldiers in our immune system, called T cells. Damage to these cells slowly destroys the body's ability to fight disease. After infection with HIV, a person may be symptom-free for years, but eventually the number of HIV viruses in the body, his or her viral load, will increase while the number of his or her T cells will decrease, weakening the person's ability to fight disease. Advanced HIV infection is known as AIDS. AIDS patients often die from opportunistic infections, OIs, which are serious infections from bacteria, viruses, or fungi that our body would normally be able to fend off. Through research and experience, scientists have learned the importance of tracking the viral load of HIV in the body as well as the patient's T cell count. It is essential to suppress the viral load early in the disease cycle while maintaining and boosting the level of T cells, allowing patients to fight off OIs. There are powerful drugs and drug mixtures now available that are doing this with increasing effectiveness. With this therapy, many patients with HIV have been able to live long periods of time without developing AIDS. Some of the drugs that have been effective in fighting AIDS are tadalafil, AZT, nevirapine, and a class of drugs known as HIV protease inhibitors. Although these new drug therapies can delay the advance of HIV in the body, the virus will eventually overcome the immune system and the patient will develop AIDS and die. Today's science can only show the progression of the disease. However, with each new day, new discoveries are made and the patients are live longer and longer. Doctors are hopeful that in the near future, HIV-infected people will be able to live a total normal lifespan. Unit 10, Immunosuppressant Drugs and the Transplant Revolution. Heart means heart, cardiac, liver, hepatic, kidney, renal, stomach, gastric, lung, pulmonary. The body is protected against attack from bacteria and viruses by the immune system. White blood cells, especially those known as T cells, play a central role in this fight against harmful invaders. In rare cases, however, the neutral action of the immune system can cause problems. One such case is organ transplantation, in which the immune system attacks the new organ and causes the body to reject it. In order to suppress this rejection, several types of immunosuppressant drugs have been used. However, the discovery of cyclosporine in 1976 has been unparalleled by any other breakthrough in the long history of tissue and organ transplantation. This medication has had a revolutionary impact, enabling the graft survival rate of renal transplants to increase from 40 to 90%. It is safe to say that the drug has moved transplantation from the rare miracle into routine therapy. Cyclosporine prevents organ rejection by blocking certain immune pathways that are activated when the body detects foreign cells. At the same time, however, this medication indiscriminately blocks other cellular signal pathways, causing serious side effects such as high blood pressure and high cholesterol. These conditions can cause cardiovascular disease and kidney toxicity that may ultimately lead to organ failures. In addition, long-term cyclosporine use damages the body's immune system itself, preventing it from fighting off infections following transplant. Now research is being done to develop drugs that can prevent rejection as well as effectively as cyclosporine, while avoiding its harmful side effects. One such drug is belatacept. This promising new immunosuppressant prevents T cell activation by selectively blocking one of the two signals T cells need in order to become fully activated and to initiate an immune response against the transplanted organ. By selectively blocking this co-stimulatory signal, the drug allows the body to continue fighting infections while preventing organ rejection. Though further study and testing must be done before the drug can be recommended as a routine replacement for cyclosporine. Belatacept could brighten the future of many who suffer from chronic renal disease and other types of organ failure. Unit 12, Part 3, Side Effects and Reactions. Adverse drug reactions. Antidote means that the substance that stops the effect of the poison. Vigilant means that keeping careful watch for possible danger or difficulties. Hospitalization means that putting someone in the hospital for treatment. Administration means that the act of giving a drug to somebody. Incidence means that the number of times something happens, especially something bad. Adverse drug reactions (ADRs) are always a last risk lurking behind the beneficial effects of drugs. In the US alone, it was estimated that some 2.2 million serious ADRs occurred in 1994, with 106,000 of them fatal. The study shows that 2.1% of inpatients experienced a serious ADR, and that 4.7% of hospital admissions were due to a serious ADR. Physicians are obligated to report all serious ADRs to MedWatch, the FDA's early alert system. Without the doctor's cooperation, the safety of new drugs cannot be assured. Pharmacists, nurses, and other healthcare practitioners also play an important role in reporting ADRs. ADRs can be classified as mild, moderate, severe, and lethal. Mild ADRs usually do not require an antidote therapy or prolonged hospitalization. Moderate ADRs may require special treatment, continued hospitalization, or change or cessation of the drug. Severe ADRs require specific treatment and discontinuation of the drug. Lethal ADRs directly or indirectly contribute to the patient's death. ADRs are influenced by both patient-related and drug-related factors, a patient's age, sex, and genetic factors, as well as the route of administration, duration of therapy, or dosage, or affect the incidence of ADRs. For example, the probability of ADRs is higher and the severity of the action greater in the elderly. There are many types of adverse drug reactions. Two most common types are side effects and drug allergies. Side effects are usually an extension of the way the drug works in the body. For example, a pill taken to lower the blood pressure may lower it too much. This could make someone feel faint when he or she stands up. Side effects can often be treated or prevented. On the other hand, a drug allergy is a reaction of the body's immune system to a drug. Symptoms can include itching and flushing of the skin, difficulty in breathing, or fast heart rate, and upset stomach. Drug allergies are dangerous because they strike rapidly within 1 to 15 minutes and can be life-threatening. Prevention of ADRs requires familiarity with the drug and potential reaction to it. Mild ADRs can often be recognized before it became serious. Costs associated with treating ADRs are estimated up to $4 billion a year. Fatal ADRs rank in the top 10 causes of death in the US. This is an important issue. While medical professionals and patients are happy to enjoy the benefits of a new medicine, they must always be vigilant against ADRs. Mm,